Zang Fu, The Organ System of Traditional Chinese Medicine by Jeremy Ross, page 221, chapter 17, Clinical Method. Treatment. Having gathered information from observation, interrogation, pulse and tongue, and on the basis of this data, having correctly differentiated the pattern of disharmony involved, the next stage is treatment. Proper treatment involves the correct selection, location, and use of acupuncture points for the particular pattern of disharmony. Choice of points. As seen in Chapter 5, each of the common disease patterns is organized in terms of yin-yang, 8 principal patterns, disease factors, substances, Jing and Zang Fu, and for every patient, the points used are selected according to these principles. For example, in cases of premenstrual tension and of headache of the type given in the example above, yin-yang and 8 principal patterns. For internal deficient, uh, for internal deficient heat, i.e., deficient yin, points would be used to nourish the yin. For example, San Yin Jiao, spleen 6, and Tai Chi, kidney 3. Disease factors. For internal emotional disharmony of the type related to restlessness and insomnia, points such as Inshi, Heart 6, Shenmen, Heart 7, Intang, MHN3, and Amniam, MHN54, could be used to pacify Shin and mind. For emotional disharmony of the type related to irritation and premenstrual tension, Taichung, Level 3, could be used to pacify Gan. Substances. For disturbance of Shen, the points listed for restlessness and insomnia could be used, and for deficiency of Jing, the points listed for deficient yin could be applied. Zang Fu and Jing for the pattern of deficient Gan yin, points such as San Yin Jiao and Tai Chi could be used, and for the hyperactive Ganyang with invasion of Dan channel, points such as Taichung, 20, gallbladder 20, and Baihui, Dumai 20, could be used to pacify Gan and to regulate the hyperactive yang in the head. In summary, in such cases, points such as Taichung, 20, Baihui, San Ninjiao, Taishi, Inshi, Shenmen, Yintang, and Damian could be used for the reasons stated. But this is only the theoretical example, and actual patients would be assessed according to their individual needs at the time of treatment. Use of points. Following correct selection and allocation of the acupuncture points, the next step is correct point use. In this, there are three main aspects. Correct choice of a method of use, production of needle sensation, correct technique of insertion, manipulation. Correct choice of method of point use. The main method is acupuncture needle with manual manipulation, but there are many other techniques. For example, moxibustion, cupping, bleeding, tapping, embedding, electroacupuncture, and so on. Since these techniques are dealt with in detail elsewhere, they will not be discussed here. Production of needle sensation. With good needle insertion technique, the patient may or may not experience a pinprick as the needle pierces the skin. But if the needle is blunt or inserted too slowly, piercing the skin may be distinctly painful. However, once the needle is through the skin, the practitioner aims to produce a quite separate feeling, deichi, or the needle sensation. This is felt as a sensation of numbness, soreness, heaviness, aching, or distension, and some patients may feel a sensation of heat or cold, or a sensation like a dull electric shock. This sensation is distinct from the pain which may follow if there is incorrect location of that point, or if the needle grates against bone, pierces a blood vessel, penetrates a main nerve, or becomes entangled in a tendon. It's important that both practitioner and the patient can distinguish between pain and the true needle sensation. The latter may be uncomfortable, but it is distinct from pain. Daichi indicates correct location of the point, and pain indicates incorrect location, except for some points, such as those on the palms and soles, and on the tips of the fingers and toes, which are definitely painful, even on correct location. Also, although daichi is usually obtained from points on limbs and body, practitioners may not attempt to produce sensations of soreness, etc., on head and face. Some merely insert and gently manipulate, avoiding any strong sensation. Others aim to produce mild feelings of destination only. Daichi, needle sensation, or needle reaction, is said to indicate the arrival of qi at the acupuncture point. The importance of obtaining qi cannot be overemphasized, and if it is not obtained after insertion, various methods of needle manipulation should be used until it arrives. However, in weak patients, daichi may be difficult to obtain. It may only come slowly or perhaps not at all. Generally, if daichi comes quickly and easily, it's a good prognosis, indicating the patient has sufficient qi within the channels to assist recovery. If daichi is hard to obtain, it may indicate a poor prognosis and a slow recovery. However, daichi may come more easily as the treatment progresses and the strength of the patient increases. For some acupuncture points and for some patients, daichi may always be poor, although treatment brings result. But as a general rule, presence of daichi indicates the correct location of the point and the likelihood of a good response to treatment. And absence of daichi indicates incorrect location or the likelihood of a poor response. Correct technique of insertion, manipulation. The topic is dealt with in detail elsewhere, and indeed, the variety of different techniques is often confusing to the student. Wrist, the more complex techniques, with their lovely names like Battle of the Tiger and Dragon and the male and female phoenix ruffle their wings, may have validity in certain situations. It's important that the student understands the basic principles of manipulation technique before moving on to the complexities. The three fundamental methods of needle manipulation are related to the three basic conditions of disharmony: excess, deficiency, intermediate, or mixed. Excess condition must be reduced, deficient condition must be reinforced, and intermediate conditions balanced. In Table 17.7, the three main methods of needle manipulation are listed, along with the associated conditions for which they are used, the type of manipulation adopted by the practitioner, and the type of sensation felt by the patient. Table 17.7, the three basic methods of needle manipulation. Reinforcing method. Condition is deficiency. Manipulation is gentle, slow, and small. Sensation is gentle. Even method. Condition is intermediate or mixed. Manipulation is moderate. Sensation is moderate. Reducing method. Condition used are excess. Manipulation is strong, fast, and large. Sensation is strong. Whether reinforcing, even or reducing method is used, the needle is inserted and daichi obtained in every case. The difference between the three methods lies in the strength of the needle sensation felt by the patient and in the type of manipulation used by the practitioners to obtain it. In the case of deficiency, especially in a patient with a weak constitution, gentle manipulation is used so that the needle sensation is gentle in order to reinforce gently and to strengthen the deficiency. If strong manipulation is used, producing a strong needle sensation, the patient may simply faint because his energy is weak, and in the West, be reluctant to return for the treatment. On the other hand, if the patient is suffering from an excess condition, for example, severe pain or fever, gentle needle sensation may not be sufficient to reduce the excess. Nevertheless, although strong manipulation is especially appropriate for a condition of excess in a patient with a strong constitution, in an excess condition in a patient with a weak constitution, it is best to observe caution and not to use excessively strong manipulation, or again, the patient may lose consciousness. Severe pain is generally associated with an excess condition, and the analgesic effect of adductor acupuncture in such cases is seen as a reducing method, equivalent to strong manual manipulation of the needles. For example, medical and dental operations, childbirth, and conditions of extreme pain in general practice, such as tri- tri- trigeminal neuralgia. In Asia, fevers are a common category of excess condition in the form of acute internal heat. The heat is reduced by the use of appropriate points using reducing method, using stronger stimulation without retaining the needles, or alternatively, retaining the needles and manipulating intermittently. For example, malaria or bacterial dysentery. Such febrile diseases are rarely treated by acupuncture in the West, where the majority of cases met with in general practice are those of deficiency and or stagnation. Rest reducing method but may be used to remove a local stagnation in the channel and area. For example, the use of Tiako stomach 38 for frozen shoulder or Neihegu NUE 17 for neck sprain. In the West, reinforcing and even method are more commonly used than reducing method. Generally, acute conditions have aspects of excess, even if they are based on underlying deficiency. In such cases, reducing method might be used during the acute excess phase, and reinforcing method might be used between acute attacks to strengthen the underlying deficiency. However, even in the acute phase, it may be safer to use even method if the patient is especially weak or fainting may occur. Summary: successful treatment relies on the correct selection of the points, their acute location, and if manual insertion of acupuncture needle is the appropriate general method, on the proper use of the appropriate type of needle manipulation. Also, it's generally essential to obtain Daichi. There are three basic conditions: excess, deficiency, and intermediate. To reduce excess conditions, the practitioner uses strong manipulation so that the patient feels a strong needle sensation. To reinforce deficiency, gentle manipulation is used to produce a gentle needle sensation. In conditions that are intermediate between excess and deficiency, or in conditions that contain aspects of both excess and deficiency, the even method is used, with moderate manipulation and needle sensation.